Kaplan approach, the lateral approach, this is more anterior to the Cocker approach. It can access to the radial head, lateral collateral coronoid ligament, distal humerus capitellum, and pin decompression. 4 cm longitudinal from the tip of the lateral epicondyle distally towards the Lister tubercle. The plane is between the ECRB and EDC. Extensor carpi radialis brevis is supplied by radial nerve or pin, and EDC is supplied by pin. ECRB has variable innervation as well, 50% by pin, 35% by superficial, and 15% by radial. The dissection close to the annular ligament to prevent instability. Pin is more at risk during this approach. Posterior interosseous nerve, radial nerve, lateral antebrachial cutaneous nerve. Whenever in the exam, lateral condyle fractures, we will say, I will go through Kaplan approach between the ECRB and EDC, as it is safe and it is better than Cocker approach, which jeopardizes the blood supply of the posterior aspect of the humerus.